welcome to Health 360. I'm your host, Alicia Martin. This week, we're focused on World Breastfeeding Week 2020 under the theme Breastfeeding for a Healthier Planet. Today, I have with me virtually two esteemed guests, Dr. Unika Scott, the Maternal and Child Health Officer attached to the Ministry of Public Health, and Ms. Gillian Trim, the Public Health Nutritionist attached to the Food Policy Unit, Ministry of Public Health. Welcome, ladies.
Thank you, Alicia. Thank you so much.
Thank you. Thank you for having me, and good afternoon, Guyana.
Thank you guys for joining me today. So to get started, Dr. Scott, could you tell us a little bit about Breastfeeding Week 2020?
Well, Alicia, as you rightly said, World Breastfeeding Week began on the 1st of August 2020, and it will end on the 7th of August. That's on Friday. And of course, this theme resonates around supporting breastfeeding for a healthier planet. But there is a message in the theme, and it relates to what it means to be breastfed, the process of breastfeeding, the results that are had from this process, a healthier planet. It's a natural way, it's an environmentally safe way, and of course, it is free. So, breastfeeding provides every child with the best start on life. We know this. This is not a debatable fact in the 21st century. It also delivers health, nutritional, and emotional benefits that are incomparable to any for the first 1,000 years of a child's life. It's a natural process, but it may not always be easy. And I guess later on in the program, we will get to elaborate, on some of the challenges. From the very beginning, though, Alicia, I will say that civil society on a whole needs to be charged to respect this very sacred process, if I may call it that. All sectors, the public and private sector, um, need to acknowledge how important it is to make adjustments that respect the process of breastfeeding. I'm going to allow Ms. Trim to share some of what are stats related to breastfeeding that we want to share with the public today.
Thank you very much, Dr. Scott. And as Dr. Scott rightly said, breastfeeding is natural. It provides a balanced diet for our children. We promote breastfeeding from birth all the way through to 6 months. That's exclusive breastfeeding. And then we encourage continued breastfeeding until the child is 2 years and beyond. But unfortunately, we have some very negative statistics as it relates to breastfeeding. Over 20,000 mothers die every year because of inappropriate feeding practices. We also have over 83,000 deaths, infant deaths a year, also because of inappropriate feeding practices. And over $3.2 billion in economic loss is incurred because of poor infant feeding. And that is information taken from our Lancet Journal 2018. So we need to reduce these maternal deaths, we need to reduce these childhood deaths, and we need also to reduce the economic costs. So we want to encourage mothers to breastfeed exclusively for 6 months, and then continued breastfeeding. It's all about child survival. And we know that there are so many benefits for breastfeeding. The list is long. Breastfeeding benefits the baby, it benefits the mother, it benefits the family, and as Dr. Scott said, it also benefits the environment. Breastfeeding is environmentally friendly, doesn't produce any waste. So those are just some of the breastfeeding benefits, and I have more to share with you as we continue in the program.
So I know that we're experiencing a global pandemic at this time. So Dr. Scott, could you tell us a little bit about COVID-19 and breastfeeding?
Yeah, sure. But before I go into that, Alicia, I really am admirable of Miss Trim's resolve. Just listening to her speak, she went right into it. And that is something that we want to acknowledge when it comes to the topic of breastfeeding. We no longer need to give an elaborate introduction and then we explain the benefits. it's to a point where it is well known. So we are at a stage where we advocate, share the stats and let everybody come on board with what, like I said before, is well known. But we're in the middle of a pandemic, and some questions have arisen about breastfeeding during COVID 19. What if the mother is COVID positive, diagnosed with COVID 19, or is a suspected case? And a couple of things that we want to share with Guyana and the general public. We want to remember, and we will be echoing this throughout the program, that nature has given us, as I said before, a most incomparable gift to protect the future of the world, and that is our children. Breast milk plays an important role in preventing life threatening illnesses. That's even before COVID 19. So, if we know that, to not breastfeed at this time seems highly illogical. Where the threat of COVID 19 is now present to our infants and newborns, to not breastfeed would be harmful to both the mother and the baby. And especially when we think about breastfeeding, we forget the benefits that the mother derives from breastfeeding. I hope that Ms. Trim can further elaborate on some of those benefits from the mother. So, as a ministry, our standpoint is quite clear that we are by no means promoting any milk substitutes for our newborn, even in spite of the presence of the pandemic, the era that we're living in. During COVID 19, we continue to support standard breastfeeding practices and norms which have already been instituted in our communities. But for those of a scientific mind, and there are always those people that we have to convince, we usually don't recommend breastfeeding, or I should say, we have a contraindication to breastfeeding when there's a risk of transmission of any disease. For example, with HIV positive mothers, because breast milk and the active component of HIV is found in the breast milk. Our recommendation as a ministry is not to have that mother breastfeed. But in the case of COVID 19, this is not so. Research to date has not detected rather the active replication component or agent in the breast milk. So the benefits of breastfeeding still remains historical, traditional, and it outweighs any potential risk of transmission to COVID 19. But if the mother is suspected or confirmed to be infected with COVID 19, we still must remain cognizant that there is a chance to transmit the virus from mother to baby. And this is through respiratory droplets, as you know, that when the mother is handling or managing the baby, she can pass by coughing or sneezing, if she does not protect herself and her baby. So, our strong advice will be that infection control and prevention measures must be taken by the mother, and not just the mother, but everyone around baby. We want to say that for newborns, now more than ever, we cannot allow anybody from off the street because of asymptomatic transmission to come pick up baby, kiss baby. It may be hard because we want to show a lot of love and affection to children, but no, this is not something that we are encouraging at all. Mothers must also be counseled, as well as the immediate caregivers of the mothers and of the babies, to practice the highest of hand hygiene before and after touching the baby. So you wash your hands with soap and water for the recommended time period. We must clean surfaces wherever the baby may come in, may be in contact with, like our diaper boards or cribs, any kitchen surfaces, much regularly. And of course, mothers must wear a mask as long as they are positive or suspected to be infected with COVID 19 and they have newborns while they're breastfeeding, a mask is encouraged. And like we have established in many of such previous media briefs, that the mask really is to protect the baby when the mother coughs or sneezes. And I want to say that the question has been raised, if the mother is too ill to breastfeed, then what then? The recommendation that the ministry has made is that breast milk should be expressed whenever possible and the baby can be spoon fed with it. This is in keeping even in our postnatal units as well. In the communities, we are not encouraging separating mothers from babies because you know that bond is of utmost importance for the health of the child. And when the mother is discharged and she attends clinic, there must be that continuum of care and that continuum of service that goes to supporting breastfeeding counseling from the physicians, the nurses, the midwives, etc.
Thank you, Dr. Scott. Ms. Trim, could you tell us a little bit about those benefits that you mentioned earlier?
Okay, well, let me start out by giving some benefits for the baby. We know that breastfeeding is baby's first immunization. Antibodies are transferred from the mother to the baby through the breast milk, and that helps to protect the baby. And that is very important, especially for newborns. As Dr. Scott said, it's a balanced diet for the babies. We don't have to give baby anything else, no water, no formula, no teas, nothing is. Just breast milk. It has all the nutrients that the baby requires. Breastfed children do not get constipated. The breast milk helps to keep your baby very regular, so we do not have to worry about the baby becoming constipated. We find that happens with children who are formula fed. They tend to become constipated, but not a child on breast milk. It protects baby against infections, ear infections, pneumonia, and other childhood illnesses. And it has been proven that breastfed children have a higher IQ. They're brighter in schools, they go on to higher education, they get higher paying jobs. So the benefit of breastfeeding is long lasting for the baby. And some of the benefits for the family: breast milk is readily available. We find our mothers, we don't have to use fuel, we don't have to hot up the water. Readily available from the mother straight to the child. It saves time, preparation time. The mother does not have to prepare anything. It's ready available and at the right temperature for the child. No need to purchase bottles, no need to purchase milk, no need to purchase formula, so it saves money. And also no fuel is needed as I mentioned. And also some benefits for the environment, as Dr. Scott said: no waste, no tins, no bottles. We also have a cleaner air because no fossil fuel is used. Fossil fuel is used to transport the formula from one point to another. It is also used in the manufacture of these formulas and also the containers, the tins. So it is environmentally friendly.
Thank you,
Alicia.
Ms. Trim. How can fathers contribute to the breastfeeding process? How can they help in that area?
That's a
Well,
very good question, Alicia, and I'm glad that you asked that question. Far too often we forget that it takes a community to raise a child, and more directly, it takes a family to raise a child. We know that postpartum, the postpartum period offers some amount of emotional imbalance to mothers. Fathers can be extremely supportive. We have admonished and urged all our healthcare workers to include the fathers in counseling for breastfeeding, not just, the grandmother or the aunt or the sister, but to speak to how important it is for the father to observe that bond, to encourage the mother to breastfeed. There are some some concerns, especially when it comes to the nipples of the mom being a little bit sore. So you may want to, as a father, pay attention to that. Pay attention to helping your wife or your spouse or your partner, clean the nipple gently. And as long as we include fathers in the conversation about how beneficial it is, then I think fathers would be a pivotal uh, would play a pivotal role in speaking to their spouses to continue the process and supporting them emotionally along the way. Miss Trim?
Yes, fathers can also help with feeding the babies because we do not advocate the use of bottles. We say if the breast milk is expressed, we recommend that it be fed to the child using the cup and the spoon. And we also like to educate fathers in terms of the cost, because mainly we have men who are the breadwinner in the family. So if we let them know what the cost is involved in terms of buying the formula and buying all of the other things to accompany formula feeding, the cost is a large percentage of his income. And if that is added up over time, we find that a lot of savings can be incurred by whoever the sole breadwinner is for the family.
And I think it's important to add to that men do get involved when they see this almost heavenly tiny creature. They're moved. Many men would tell you that when they first laid eyes on their newborn, it's as if they magically became different persons immediately. And that's a good opportunity for them to be incorporated in the care of the child because of how this young life has touched them. So healthcare workers, community leaders, even mothers, please let us not leave our dads or fathers out of the conversation of breastfeeding and bonding and caring for their newborn.
Thank you both. Some very, very good
If I may
information. Go ahead, Mr.
Yes, I did not give the benefits of breastfeeding to the mother. And it's very, very important for our women. Now, breastfeeding reduces the risk of ovarian cancer in mothers. Studies have shown this. Breastfeeding also reduces the risk of breast cancer in our mothers. It aids with child spacing and helps to relieve engorgement of the breast. It helps to restore the ability to have you would like to have your Coca-Cola shape again, as we usually call it. So breastfeeding helps the mother to restore her shape that she had even before pregnancy. So there you have it, the benefits for the mother. So we have benefits for the mother, the family, the baby, the caregivers. Alicia.
Thank you, Ms. Trim. For mothers who would have to go back to work after the 3 months maternity leave, um, what measures can be put in place to ensure that even while the baby is at home, that he or she receives adequate amount of breast milk?
Well, as you know, Alicia, breast milk could be expressed and safely kept and then fed to the child. But I want to focus on the work environment. Look, we have got to encourage change. We have got to put aside in our public and private sector the breastfeeding room, at our airports, the breastfeeding room. I know that at, I think, some of our malls, we have a breastfeeding corner or a breastfeeding space. Employers should acknowledge Breastfeeding Week. They should acknowledge the moms who are breastfeeding, give a little bit of extra time off for mothers to go home and breastfeed their baby by the natural means whenever possible. We understand that women are an important force to reckon with in the work environment. But the work environment needs to, and it's finally time for the work environment to come to terms with how important it is to acknowledge the process of breastfeeding, to encourage it, to make provisions for it, and to respect our women and their newborns so that there is no pressure unduly so, to have the woman be at work for long hours. And everybody will be regarded because rewarded, sorry, at the end, because as we've rightly pointed out repeatedly in the last half an hour, that there are benefits to the future generation. So if you start from the time the child is born and you are able to contribute as an employer to a healthy baby, then by and large, it influences a healthy workforce in another 18, 20 years. So make provisions. Feel free to make provisions for your women who are employed and who are um, new mothers to have their babies even brought to a safe space to be breastfed as often as is possible. And those are the little, the little victories that we have when we speak to the humane nature of our work environment.
Yes, and if I may add to that, because since last year we have been advocating for breastfeeding spaces. So we'll be visiting organizations and we'll be pushing from the food policy division to have a private space for a mother to express her milk. We will also advocate for flexible working hours, as Dr. Scott had mentioned, facilities to support breastfeeding, for example, access to a refrigerator where a mother can store her milk. And we also want to encourage her fellow employees to provide help and assistance that she may need. Because remember, she's a new mother, she has a baby, she will need lots of assistance. So we want to accommodate her in every possible way to ensure that breastfeeding is successful.
Thank you both. For those mothers who are breastfeeding, what are the types of foods that they should be consuming during that period?
Okay, well, we usually advocate for mothers that they must ensure that they eat a balanced diet. And this is not only for mothers, this is for everybody. Because remember, the mother, she has a growing fetus. So she has to ensure that she gets all the nutrients that's required for herself and for a growing baby. So we recommend that you eat foods every day from all of the six food groups. And those six food groups are your staples, your fats and oils, your legumes, your food from animals, your fruits, and your vegetables. Very, very important. Mothers have to also make sure that they eat foods that are rich in iron and also folic acid because that helps in the development of the baby and also in making her blood. So these foods, iron is found mostly in meat, and we can also get some in our vegetables or green leafy vegetables. But we recommend that she eat lots of fruits and vegetables, drink lots of water, and ensure that she eats a balanced diet every day. Dr.
Right.
Scott?
We can't forget the water. That's very important. And Miss Trim and Alicia, postnatal cravings are not to be minimalized. We understand that just as there is a presentation of cravings while the mother is pregnant, after delivery there are cravings. So we don't discourage cravings. We're just cautious as to the overindulgence of them. So we want mothers to eat, as Miss Trim said, a balanced diet, but they can also indulge in their cravings, especially if your cravings are for apples and fruits. Please do, by all means.
Go right ahead.
So I thank you both for joining us in the program today. But before we go, do you guys have any advice or encouragement to all those persons who are viewing us right now?
Well, Alicia, particularly to our healthcare workers, we know that COVID-19 has brought some challenges within the work spaces, within our postnatal units, within our prenatal units. We know that it's easier to separate baby from the mother, especially if the mother is a suspected case of COVID-19 or has been tested positive. Um, that being said, it is still imperative for all of our healthcare workers to understand that it is the mothers right to breastfeed. And so, whenever possible, we want to ensure that we do our utmost to support that right, to support the mother's rights and the family's rights, as long as there's no medical contraindication. And that's where the ministry, what the protocol that the ministry is supporting as it relates to breastfeeding and COVID 19.
Ms. Trim?
Yes, I would just like to say to our mothers of newborns, congratulations. You have received a gift from God. And also, I'd like to say to you that breastfeeding is God ordained. And how do we know that? It's because God sends the baby with their food. Baby comes with their food, which is readily available. So God intends for us to breastfeed. So we want to encourage you to make sure that you breastfeed. I know it can be difficult. You need all the support that you can get. Exclusive breastfeeding from birth to 6 months, and continued breastfeeding. At 6 months, you would introduce complementary foods, but you continue breastfeeding until the child is 2 years and beyond if the mother and child are comfortable. I outlined to you some of the benefits of breastfeeding, and this list is very short. There are so many more benefits to breastfeeding, but I also want to encourage your family, your spouses, your husbands, your older children, your uncles, your nieces, your nephews, everybody has to support breastfeeding because everybody stands to benefit from breastfeeding. So let us breastfeed, let us reduce the maternal deaths per year, let us reduce the childhood deaths, and let us reduce the economical loss. Breastfeeding is very important.
Thank you, Ms. Trim, for joining us today. Thank you as well, Dr. Scott. I want to encourage you guys to keep up the good work that you guys are doing at your units. And to the public, let us all support breastfeeding for a healthier planet. Goodbye for now, Guyana. Stay safe.